Hi, I'm Dr. Sabrina Shah-Desai, an aesthetic oculoplastic surgeon based on Harley Street in London. And I'd like to talk to you about upper lid blepharoplasty, a surgical procedure to treat hooded upper eyelids. Now, this surgical procedure is also called an eyelid lift, and the word itself is very telling because patients who come to us with hooded eyelids are actually walking around with blinkers on their eyes, and it affects their peripheral field of vision. Often I'll have patients telling me that they have chronic headaches and they think that Botox is going to correct the deep forehead lines they have. But those deep lines exist because they're constantly raising their eyebrows to clear the hood from their eyelids and to improve this blinkered appearance. So what does an eyelid lift surgery involve? Essentially, I prefer performing the procedure under a local anesthetic. This is a day case procedure, similar to you going to your dentist. However, you do go home without your hooded eyelids. You will have tapes on your upper eyelid covering the scar line that is hidden inside the fold of your skin where the skin has been cut and removed and the surgery is being performed. So, who is suitable for an upper eyelid blepharoplasty? If you have loose excess upper eyelid skin and you can pinch the skin, we can remove it. Also, it's really great for removing puffy upper eyelids. So if you've got a big prolapse of fat in this inner corner on the upper eyelid, it's a really good procedure for debulking and depuffing those fat bags. Most of my patients can go back to work 10 days after the procedure, and there's a fine little cut made in the upper eyelid and the stitches are removed approximately a week to 10 days after the procedure, and any bruising or swelling can easily be covered with camouflage makeup. We have a special camouflage makeup that is used very frequently. And eyelid lifts for men are performed differently from an eyelid lift for women, because I have to maintain the male aesthetic and the rugged appearance of a man and not feminize a man. Often with hooded eyelids, patients can have an element of a droopy brow, and this is called a brow ptosis. And sometimes the brow needs to be supported, and this can commonly be supported with a bit of chemical brow lift with botulinum toxin, which is a temporary effect and needs to be repeated every 3 to 5 months. Sometimes we need to surgically enhance the brow directly by either making a very tiny cut at the outer corner of the tail of the brow and lifting the brow, or indeed from the inside from the same cut as in the upper eyelid, or we can even make a cut at the hairline, and this is called a pretracheal brow lift to support the brow. How long does an eyelid lift last? It can last a good decade. If you have any further questions, please don't hesitate to contact my team at Perfect Eyes Limited or visit my website. I look forward to seeing you.